One supplement in this video lowered blood sugar so effectively, researchers compared it directly to a prescription diabetes drug. Another only worked for people with a specific gut bacteria profile, and one is probably already sitting in your kitchen. 1 in 3 American adults has prediabetes, and 80% don't know it. But this is the one stage where you have real control to turn it around. Let's start with the one doctors talk about most. 1. Berberine, the one researchers. Compared to medication. Berberine comes from a plant called barberry, and it's one of the most heavily studied natural compounds for blood sugar. In a randomized, placebo-controlled trial specifically on people with prediabetes, daily berberine reduced fasting insulin and HbA1c compared to placebo over 12 weeks. In a separate clinical trial on people with type 2 diabetes, the effect was strong enough that researchers found its blood sugar-lowering power was comparable to metformin, one of the most common diabetes medications. Typical study doses are around 500 milligrams, 2 to 3 times a day. But because berberine can interact with other medications, this is one to run by your doctor first. If your doctor has ever told you your blood sugar is creeping up, you're not alone. And this is exactly the range where lifestyle and natural options have the most power to change your numbers before anything more serious develops. Here are 4 more, each backed by real clinical research. 2. Ceylon Cinnamon, not the cinnamon in your cabinet. Regular grocery store. Cinnamon, cassia, is different from Ceylon Cinnamon, and the research doesn't always match between the two. A 2025 randomized, double-blind trial using Ceylon Cinnamon extract found a significant drop in fasting blood sugar after 12 weeks compared to placebo. If you try this one, check the label for Cinnamomum zeylanicum. That's the Ceylon variety the research actually used. 3. Fenugreek, the seed with the longest track record. Fenugreek has been studied longer than almost anything on this list. One clinical study followed pre-diabetic patients taking 10 grams of fenugreek seed powder daily for 3 years and found a significant reduction in both fasting and after-meal blood sugar. Results vary more between studies than berberine or cinnamon. So think of this as a solid, well-tolerated option rather than the single strongest one. Most people take it as a standardized extract capsule, since the raw seed has a noticeably bitter taste. 4. Broccoli sprout extract. The one almost nobody's talking about. A randomized, placebo-controlled trial published in 2024 tested broccoli sprout extract, the source of a compound called sulforaphane, directly in adults with prediabetes. Here's the twist. People with mild obesity and a specific gut bacteria profile showed a notably stronger blood sugar response than others. That's the gut bacteria connection from the intro. This might work better for some people than others, depending on their microbiome. It's an early finding, not a guarantee, but it's one of the most genuinely new pieces of research in this space. 5. Apple cider vinegar, the one already in your kitchen. This is the one from the intro that doesn't require buying anything. Vinegar's acetic acid slows how fast your stomach empties and blunts the blood sugar spike after a carb-heavy meal. About a tablespoon in water, taken before eating. It's the mildest effect on this list, but it's free, low risk, and stacks well with anything else here. A quick gut check before you run out and buy all 5. More research still needs to happen, especially on broccoli sprout extract, and supplements can interact with medications you're already taking, especially berberine. If you're on any diabetes medication or have other health conditions, talk to your doctor before adding any of these. But if you wanted natural options with actual clinical data behind them instead of just folk wisdom, these 5 are where the real research currently points. Subscribe for more health truths backed by actual science.